Ma'am?
You still here? Okay, hold on just a moment.
All right.
I'm just trying to get some answers for you.
Mhm.
Okay, sir. I'm gonna transfer you to our complaint line, and they will be able to assist you on what you need to do.
Is there a supervisor that I could speak to in person at the AHCA location at the 2727 Mahan Drive?
Not to file a complaint. No, you need to either file online or talk to someone on the phone.
Yeah, that's the thing. As I mentioned to you already, when I previously did that, it made things worse. That's why I was,
I mean,
because
if you speak with someone in person, what's supposed to happen? I mean, if you are you trying to remain anonymous? Like, what's making it worse?
well, when I spoke to somebody over the phone previously, I mean, when I filed the complaint online, it made things worse previously. But I'm in Tallahassee, Florida now. I live in Tallahassee, Florida now.
I'm
So
in
I figured,
Tallahassee too, but I'm trying to make sure I'm understanding you. If you file the complaint in online and it made it worse, and you coming here to tell the same complaint to what then?
so I was hoping maybe I could speak to a supervisor in person. Maybe we can sit down. I could tell the supervisor. We could put it in writing, and then we take the necessary steps from there to
Okay, you can
eliminate the
speak with
problem.
someone on the phone and let them know exactly what's going on, and if the situation got worse, you can also explain that to them. Either talking to them on the phone, the people that you are going to give the complaint to um, will be the same person if you were able to come out here to talk. So
Well,
you can let
that's
them know that.
yeah. That's the
Hold
thing.
on,
I don't know.
hold on a moment.
I don't know who I'm talking
Hold
to
on.
on the phone. That's the thing. I'd rather speak to them in person. You know.
You're talking to the people. You're talking to our team that takes the complaint.
Well, that's the thing. I don't know who they are. You know. I haven't
Hold
seen
on,
their
sir.
ID badge or anything. It's better
If
for
you
me
if
only
you
from
call if you
experience to
calling
speak
if
to
you
somebody in
calling
person and know who
ARCA
I'm talking to.
if if you calling ARCA, you are speaking with a representative here at ARCA. So hold on just a moment. Thank you for calling the Agency for Healthcare Administration. This call may be monitored for training purposes. Please listen carefully to the following updated options as they have recently changed. You will have a number of options to choose from. Would you like to know if you qualify for Medicaid services, need a replacement gold card, or want information about the medically needy program? Please call the Department of Children and Families at 1-866-762-2237. If you are calling about the services provided under your Medicaid health insurance plan, such as transportation, dental services, verifying treatment coverage, or want to change your plan, press 1. If you are filing a complaint about the care received in a healthcare facility, press 2. If you have questions regarding background screening results, exemptions, or the BGS clearinghouse, press 3. If you are calling to file a complaint against your Medicaid HMO, Need a status on a Medicaid claim or have Medicaid-related questions? Press 4. To learn more about our agency, please visit www.ahca.myflorida.com. Again, that's www.ahca.myflorida.com. If you need assistance with other areas of our agency, press 5. All of our agents are currently helping other individuals. Please.
Good afternoon, Agency for Healthcare. Can I help you?
Yes. So, I need to speak to somebody in person. I was wondering who's the best person to speak to at the HCA 2727 Mayhem Drive location in Tallahassee.
Yeah. Where are you located?
I'm also in Tallahassee.
Okay. And what are you wanting to speak about?
Preferably, I wanted to speak to a supervisor. So I really don't feel comfortable talking about it over the phone. That's why I prefer to speak to somebody in person.
Yeah, normally we just don't do that for security reasons. Let me just check with my supervisor. I'm kind of new here. Because we got a secure location. See what she says. But what's wrong with just talking to someone on the phone? I don't understand why that's an issue.
So I previously filed complaints, and I also spoke to somebody over the phone, but it made things worse. But I now live in Tallahassee, Florida, and I noticed the location is in Tallahassee, Florida also.
Yeah.
So I figured I'd speak to a supervisor in person, maybe.
Okay, I'm trying to talk to my supervisor now. I'm sending her a message. I can't call that shot. I understand that. I think you already talked to my coworker, right?
Yes.
Okay. And what did she tell you?
It's from what she sounded like. Sounded like she didn't know what to tell me. But
Well, let me just ask you this: what's the problem? I mean, what are you complaining about?
that's the thing. I don't feel comfortable talking about it over the phone.
Okay. Well,
The reason why is from experience. When I filled out the complaint online and I spoke to somebody on the phone, it made things worse. And I literally had to move, and I'm now in Tallahassee, Florida.
Yeah. Yeah. Just bear with me. Like I said, I can't call that shot. That's just normally not how we. And what's your name, sir?
I don't feel comfortable speaking about any of that on the phone. That's why I need to speak to somebody in person.
All right.
I'd like to see, who I'm talking to, see their ID badge and things like that.
I'm going to get your number. Let's see, I'm going to call him. He can go to my voicemail. Yeah, you're going to have to speak to my supervisor. I'm going to give you her number, and you can. She's on the phone now in a meeting. You're going to have to talk to her. Okay.
All right. And what's her name?
We don't have staff, Michelle Hart, but we don't have staff that meet with complainants. They're all kind of over the place. So, like I said, I'm going to defer you to her voicemail. You're going to have to leave a voicemail for her and just put that in a request in that way. Is that okay?
No, I need to speak to somebody who.
You're not calling the shots. Okay, you're very persistent. If you want to call, you got to go by the rules. Okay.
Well, with all due respect, hold on. What's your name?
All right, sir. You're not telling me your name. I'm not telling you mine. If you'd like, I'll get you over to our legal department, and you can
Well,
discuss the matter with them.
the reason why, I'm not trying to be rude or anything, and this is the month of Ramadan, and I'm fasting. But the previous time that I filed the complaint online and I spoke to somebody over the phone, it made things worse.
How would we know? We don't even know your name. We don't even know the hospital.
Well,
I'm going to get you over to my supervisor, okay?
the main...
We've got a lot of calls coming in now. You're not the only ones that are calling in about complaints, okay? And if you want to file a complaint, you want us to look into something, you got to work with this, okay? This is plain and simple.
Yeah, the thing is, though,
I'm
it's...
not wasting my time debating, sir. I'm not wasting my time, and I don't care if it's Ramadan. I don't care if it's Halloween.
Yeah, it's causing me and my family a lot of mental anguish, though. That's the thing. That's why I'm trying to speak to the right people.
You're making it worse.
Say that again?
I'm getting you over to my supervisor. You can leave a message for Miss Hart, okay? I'm done. I'm not going to debate with you, okay?
Okay, but what's your name?
Sir, you're not giving me your name. I'm not going to give you the courtesy of giving you mine. Fair enough? Leave a voicemail for my
Well, is this the AHCA, the Agency for Healthcare Administration?
The person you are trying to reach is currently unavailable. Please leave a message after the tone. When you have finished, please hang up or press the pound key for more options. To be Thank you for calling the Agency for Healthcare Administration. This call may be monitored for training purposes. Please listen carefully to the following updated options as they have recently changed. You will have a number of options to choose from. Would you like to know if you qualify for Medicaid services, need a replacement gold card, or want information about the medically needy program? Please call the Department of Children and Families at 1-866-762-2237. If you are calling about the services provided under your Medicaid health insurance plan, such as transportation, dental services, verifying treatment coverage, or want to change your plan, press 1. If you are filing a complaint about the care received in a healthcare facility, press 2. If you have questions regarding background screening results, exemptions, or the BGS clearinghouse, press 3. If you are calling to file a complaint against your Medicaid HMO, need a status on a Medicaid claim, or have Medicaid-related questions, press 4. To learn more about our agency, please visit www.ahca.myflorida.com. Again, that's www.ahca.myflorida.com. If you need assistance with other areas of our agency, press 5. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly.
Agency for Healthcare and Administration, how can I help you?
Is there a supervisor I could speak to in person there?
No, it's not.
Is there another location that I could go to, maybe to speak to a supervisor in person?
It's not. It's not. I'm sorry.
I mean, what do I do? I mean, so I filed the complaint previously online and spoke to somebody over the phone, but
What's your complaint number?
it made things worse.
Number?
No, it's a different complaint now because it made things worse when I filed the complaint online and spoke to somebody over the phone. But I'm in Tallahassee, Florida now. I live in Tallahassee, Florida, so I figured I'd speak to somebody in person.
Sir, we don't have a staff member that will be able to meet with you to take a complaint. Our process is to file by phone or online. The same person that will take your complaint will be the same person that will process your complaint. So whether you come in here or not, it's not going to make a difference. But we don't take complaints in person. We don't have a staff to meet with you on that. Now, you can speak with someone and file this complaint, but it's no one here that will meet you in person to file this complaint. Okay, I can transfer you if you want to do it that way. That's fine. If you want to do it online, you can do it online that way. But other than that, no, it's no one that you can meet with.
Is there a supervisor I could speak to over the phone?
I can transfer you to my supervisor. Hold on just a moment.
The person you are trying to reach is currently unavailable. Please leave a message after the tone. When you have finished, please hang up or press the pound key for more options. To be transferred, press 0. Thank you for calling the Agency for Healthcare Administration. This call may be monitored for training purposes. Please listen carefully to the following updated options as they have recently changed. You will have a number of options to choose from. Would you like to know if you qualify for Medicaid services, need a replacement gold card, or want information about the medically needy program? Please call the Department of Children and Families at 1-866-762-2237. If you are calling about the services provided under your Medicaid health insurance plan, such as transportation, dental services, verifying treatment coverage, or want to change your plan, press 1. If you are filing a complaint about the care received in a healthcare facility, press 2. If you have questions regarding background screening results, exemptions, or the BGS clearinghouse, press 3. If you are calling to file a complaint against your Medicaid HMO, need a status on a Medicaid claim, or have Medicaid-related questions, press 4. To learn more about our agency, please visit www.ahca.myflorida.com. Again, that's www.ahca.myflorida.com. If you need assistance with other areas of our agency, press 5. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly.
Agency for Healthcare and Administration, how can I help you?
Yes, I was wondering, is there someone I could speak to in person there?
No, it's not, sir.
Is there another location I could speak to someone in person?
No, and no. Hold on just a moment.
The person you are trying to reach is currently unavailable. Please leave a message after the tone. When you have finished, please... Thank you for calling the Agency for Healthcare Administration. This call may be monitored for training purposes. Please listen carefully to the following updated options as they have recently changed. You will have a number of options to choose from. Would you like to know if you qualify for Medicaid services, need a replacement gold card, or want information about the medically needy program? Please call the Department of Children and Families at 1-866-766-22237. If you are calling about the services provided under your Medicaid health insurance plan, such as transportation, dental services, verifying treatment coverage, or want to change your plan, press 1. If you are filing a complaint about the care received in a healthcare facility, press 2. If you have questions regarding background screening results, exemptions, or the BGS clearinghouse, press 3. If you are calling to file a complaint against your Medicaid HMO, need a status on a Medicaid claim, or have Medicaid-related questions, press 4. To learn more about our agency, please visit www.ahca.myflorida.com. Again, that's www.ahca.myflorida.com. If you need assistance with other areas of our agency, press 5. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly.
Good afternoon, Agency for Healthcare. Can I help you?
Yes, is there someone there I could speak to in person?
Sir, we've had this conversation already. I've given you over to my supervisor. And I'm not, what else I can tell you, sir?
Yeah, it's just the main problem is, though, is that, I filed a complaint previously online, and I spoke to somebody over the phone, and it made things worse. So I was trying to speak to somebody in person.
No, you can't. I'm just going to tell you no. I'm going to get, I offered to get you over to my supervisor to leave voicemail. If you could be patient enough to let her get through her meeting, she can call you back and you can speak to her. Okay?
Yeah, it's a really urgent matter. It's making my mom cry.
You can call the police.
Say that again?
You can call the police or call the Department of Children and Families if it's that urgent. We're not a crisis agency. We take complaints and we look into them. But if it's an emergency, I'd call the police.
Okay, so file a police report first and then file the complaint with AHCA?
Well, it depends what the issue is, but you have two choices. You can file a complaint in writing, or you can talk to somebody on the phone. That's it. There's no one that's going to meet somebody just off the street and take a complaint. Okay? We get too many threats.
Yeah, I'm not.
A wall full of people threatening our agency, and we're just not going to have people come in without giving your name or the situation. Okay? So
Yeah, you won't have to worry about me
I don't want it to make
threatening anybody there. I need someone to help me. I mean, I was trying to, show them my ID. They showed me their ID, and we sit down and write the complaint and take it from there to eliminate the problem finally.
I have no idea what your name is. I have no idea what your name is. I email? You want to put something in writing? Or did you leave a voicemail for my supervisor? I'll get you back over there if you like.
Yeah, it wasn't. It just said to leave a voicemail. It didn't have anybody specifically identifying themselves on the voicemail. That's why I didn't really feel comfortable leaving a voicemail either.
Okay. All right. Well, we're not really feeling comfortable with you, sir, with your persistence in calling. Okay. It gives us, some really red flags here. So if you'd like, you can talk to our legal department, or I can get you over to our secretary's office. That's it. Okay? We got too many calls coming in. And like I said, there's nothing wrong with talking to somebody on the phone. If you don't feel fit for it, I'm sorry. That's not our issue. Okay?
Well, so I was told previously to complain to the Agency for Healthcare Administration about these types of issues. That's why I'm calling. I mean, I'm not trying to be a burden on anybody there. It's just I was told to complain to the AHCA, which is what I did previously online and on the phone, but it made things worse.
Why is it you're not willing to give us your name? Why is it you're not willing to give us the facility that you're complaining about? Why is that?
Because previously when I did that online and on the phone, it made things worse. And I had to move from the area that I was in, and I'm now in Tallahassee, Florida.
You're making your situation worse. The more you're calling, the more you're talking about the same thing, you're making us feel uncomfortable. So, I don't know what to tell you about that. Other than, sir, I'm not gonna sit here and debate with you when this isn't going anywhere.
Well, if I don't understand how you don't.
Office, if you want to call the governor's office, do what you need to do, but we're not meeting with you in person. It's as simple as that. Okay.
So you said the only other option you said to file a police report.
Well, I'm not telling you what to do. I don't know what the circumstances. I wouldn't call the police.
Well, it has to do with physical assaults and threats on my life.
Well, then call the police. I would call the local police department.
Okay, and
If it's assault, but don't you've got to decide that for yourself. You're a private citizen. I can't tell you what to do.
it's just I was told previously, when it has to do with a facility and things like that, to call the Agency for Healthcare Administration because it happened at a healthcare facility.
I'm gonna get you just over to our complaint line and you can talk to them because I'm not even with that department. So just stay on the line and you can tell the person that gets on the phone what you told me, okay? Because there's really not anything more for me to say, sir. I'm terribly sorry, but we've got too many calls coming in right now, and I've got to escalate your call now. So just stay on the line. I don't know if you're calling about a hospital, nursing home, or whatever, but just speak to the person that does complaints to them, and you can tell them that you're not comfortable. Okay, sir? All right.
All right.
Thank you for calling the Agency for Healthcare Administration. This call may be monitored for training purposes. Please listen carefully to the following updated options as they have recently changed. You will have a number of options to choose from. Would you like to know if you qualify for Medicaid services, need a replacement gold card, or want information about the medically needy program? Please call the Department of Children and Families at 1-866-762-2237. If you are calling about the services provided under your Medicaid health insurance plan, such as transportation, dental services, verifying treatment coverage, or want to change your plan, press 1. If you are filing a complaint about the care received in a healthcare facility, press 2. If you have questions regarding background screening results, exemptions, or the BGS clearinghouse, press 3. If you are calling to file a complaint against your Medicaid HMO, need a status on a Medicaid claim, or have Medicaid-related questions, press 4. To learn more about our agency, please visit www.ahca.myflorida.com. Again, that's www.ahca.myflorida.com. If you need assistance with other areas of our agency, press 5. helping other individuals. Please stay on the line, and we will be with you shortly.
Healthcare Administration, how may I help you?
Yeah, I was just speaking to, it sounded like a Caucasian elderly male. He said he was going to transfer me to the complaint line, but it just routed me back to the automated system.
Okay, yeah, it could be because their lines are busy. Did he give you the phone number? I can give you the phone number. You can try it at a different time.
Yeah, he also mentioned an email that I could send the complaint to.
Sure. Yes, sir, I can give it to you. All right, so the email address is C as in Charles, A as in Apple, U as in under, all lowercase, and then the @ symbol, and then Ahca, all lowercase, A as in Apple, H as in Howard, C as in Charles, A as in Apple, and then period, myflorida.com.
Could you say that one more time, please?
Sure. So in lowercase, C as in Charles, A as in Apple, U as in under, and then the @ symbol, and then all the rest in lowercase, A as in Apple, H as in Howard, C as in Charles, A as in Apple, and then period, myflorida.com. Florida spelled out.
And what you said, CAU? What does that stand for?
Complaints Administration Unit,
At Ahca dot.
myflorida.com.
All right.
Yeah. And did you also need the phone number for the complaints department?
Yes.
Sure. It's 850 and then 412 and then 4200.
850-412-4200.
Yes, sir.
Are you a supervisor there?
Yes, sir.
Is there a supervisor I could speak to now?
No, so this is just like the overflow line, or this is just a switchboard, so we're just able to give out phone numbers and transfer you to the department. Did you want me to try and transfer you there?
Yes.
All right, thank you.
Thank you for calling the Agency for Healthcare Administration. This call may be monitored for training purposes. Please listen carefully to the following updated options as they have recently changed. You will have a number of options to choose from. Would you like to know if you qualify for Medicaid services, need a replacement gold card, or want information about the medically needy program? Please call the Department of Children and Families at 1-866-766-22237. If you are calling about the services provided under your Medicaid health insurance plan, such as transportation, dental services, verifying treatment coverage, or want to change your plan, press 1. If you are filing a complaint about the care received in a healthcare facility, press 2. If you have questions regarding background screening results, exemptions, or the BGS clearinghouse, press 3. If you are calling to file a complaint against your Medicaid HMO, need a status on a Medicaid claim, or have Medicaid-related questions, press 4. To learn more about our agency, please visit www.ahca.myflorida.com. Again, that's www.ahca.myflorida.com. If you need assistance with other areas of our agency, press 5. All of our agents are currently helping other individuals. Please stay on the line, and we will be with you shortly.
Agency for Healthcare, can I help you?
Yes, I was just speaking to someone. They said they were transferring me to the complaint line, but it transferred me back to the automated system.
Okay. Why don't you take down this direct number? We've got dozens of calls coming in over the past hour. Do you have the number? The direct number?
Is it-
Happy to share with you.
Is it the 850-412-4200 number?
Yes, sir.
All right.
Thank Thank you for calling the Agency for Healthcare Administration. This call may be monitored for training purposes. Please listen carefully to the following updated options as they have recently changed. You will have a number of options to choose from. Would you like to know if you qualify for Medicaid services, need a replacement gold card, or want information about the medically needy program? Please call the Department of Children and Families at 1-866-762-2237. If you are calling about the services provided under your Medicaid health insurance plan, such as transportation, dental services, verifying treatment coverage, or want to change your plan, press 1. If you are filing a complaint about the care received in a healthcare facility, press 2. If you have questions regarding background screening results, exemptions, or the BTS clearinghouse, press 3. If you are calling to file a complaint against your Medicaid HMO, need a status on a Medicaid claim, or have Medicaid-related questions, press 4. To learn more about our agency, please visit www.ahca.myflorida.com. Again, that's www.ahca.myflorida.com. If you need assistance with other areas of our agency, press 5. Did you know you can file a complaint online? Visit our website at ahca.myflorida.com and select Contact Us. Please understand that staff and staff rudeness are not regulated. We urge you to contact the facility administration to report your concerns. If you have a complaint about a doctor or nurse or misdiagnosis, please call the Department of Health at 8502-454339. Again, that's the Department of Health at 8502-454-339. Or visit their website, www.floridahealth.gov. Please listen carefully to the following two options if you are calling to file a complaint against a hospital, nursing home, home health agency, laboratory, dialysis center, or hospice, press 1. If you are calling to file a complaint against an assisted living facility or other facility type, press 2. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. Are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly.
SubhanAllah. I was on hold for an hour and 4 minutes, and they hung up the phone.
Thank you for calling the Agency for Healthcare Administration. This call may be monitored for training purposes. Please listen carefully to the following updated options as they have recently changed. You will have a number of options to choose from. Would you like to know if you qualify for Medicaid services, need a replacement gold card, or want information about the medically needy program? Please call the Department of Children and Families at 1-866-762-2237. If you are calling about the services provided under your Medicaid health insurance plan, such as transportation, dental services, verifying treatment coverage, or want to change your plan, press 1. If you are filing a complaint about the care received in a healthcare facility, press 2. If you have questions regarding background screening results, exemptions, or the BGS clearinghouse, press 3. If you are calling to file a complaint against your Medicaid HMO, need a status on a Medicaid claim, or have Medicaid-related questions, press 4. To learn more about our agency, please visit www.ahca.myflorida.com. Again, that's www.ahca.myflorida.com. If you need assistance with other areas of our agency, press 5. Did you know you can file a complaint online? Visit our website at ahca.myflorida.com and select Contact Us. Please understand that staff and staff rudeness are not regulated. We urge you to contact the facility administration to report your concerns. If you have a complaint about a doctor or nurse or misdiagnosis, please call the Department of Health at 8502-454339. Again, that's the Department of Health at 8502-454-339. Or visit their website, www.floridahealth.gov. Please listen carefully to the following 2 options if you are calling to file a complaint against a hospital, nursing home, home health agency, laboratory, dialysis center, or hospice. Press 1. If you are calling to file a complaint against an assisted living facility or other facility type, press 2. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly. Thank you for calling the Agency for Healthcare Administration. This call may be monitored for training purposes. Please listen carefully to the following updated options as they have recently changed. You will have a number of options to choose from. Would you like to know if you qualify for Medicaid services, need a replacement gold card, or want information? All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly.
I was trying to get in contact with a supervisor to speak to, and I wasn't able to do that for some reason. So I tried to speak to somebody at the complaints department. They had me on hold for an hour and 4 minutes, and then the phone just hung up.
Thank you for calling the Agency for Healthcare Administration. This call may be monitored for training purposes. Please listen carefully to the following updated options as they have recently changed. You will have a number of options to choose from. Would you like to know if you qualify for Medicaid services, need a replacement gold card, or... All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly.
Thank you for calling the Agency for Healthcare Administration. How can we help you today?
Yes, I was trying to speak to a supervisor, but I wasn't able to do that for some reason. So I called the complaint line, and they had me on hold for an hour and 4 minutes, and then the phone just hung up.
Okay. You're looking to file a complaint over the phone?
Not necessarily. I was trying to speak to a supervisor, specifically because previously when I filed a complaint through the website and over the phone, the situation got worse. That's before I moved to Tallahassee, Florida. I'm now living in Tallahassee, Florida. And I noticed the location that they told me to complain to, the Agency for Healthcare Administration, AHCA, is here in Tallahassee at the 2727 Mayhan Drive, Tallahassee, Florida location.
Okay. I'll give you one moment. Okay, I'll send you over.
Michelle, how can I help you?
Yes, I was trying to speak to a supervisor, but I wasn't able to do that for some reason. So I called the complaint line, and they had me on hold for an hour and 4 minutes, and then the phone just hung up.
Okay. I'm sorry you were disconnected from our line while you were holding. That shouldn't happen, so I can check into that, but you're currently speaking to the supervisor.
Oh, great. May I ask what your name is?
Michelle?
Michelle. Is your last name Hart?
Yes.
Awesome. Yeah, they mentioned that earlier. The supervisor's name was Michelle Hart. So I previously filed complaints through the website and on the phone, but the situation got worse. And that was before I moved to Tallahassee, Florida. But I'm now in Tallahassee, Florida. And the specific location they told me to complain to was the Agency for Healthcare Administration, AHCA. And I noticed that it's here in Tallahassee at the 2727 Mayhan Drive location. So I was trying to speak to a supervisor in person so we could write down the complaints. You know, I could show them my ID, they show me their ID, so I know exactly who I'm talking to. And then we take whatever necessary steps from there to finally eliminate the problem because it's reoccurring. And I really need it to stop because it's making my mom cry. And it's causing me and my family a lot of mental anguish, and it's ruining the quality of our lives.
Okay. And I think they explained to you earlier that's not our process. We don't take complaints in person. So the same person that you talked to over the phone would be the same person processing your complaint in general. It's all in the same office. So if you want to give me your complaint now, I can do that.
Yeah, the thing is, see, I did that previously, and it made the situation worse. And from experience, you know, I don't want to make the same mistake twice.
Okay. So you filed a complaint with us previously. What's your name?
So my full name is Omar Mohsen Ibrahim Fouad. First name Omar, last name Fouad.
Oh, okay. And how do you spell the last name, please?
F as in Foxtrot, O as in Oscar, U as in umbrella, A as in alpha, D as in Delta. And another, serious reason why I wanted to speak to somebody in person is because also it's Ramadan, and I'm having to bring these situations to the attention of my mother, and it's making her cry. And it's causing me and my family a lot of mental anguish, and it's causing her to have to break her fast also during the month of Ramadan. And one of the representatives that I was just speaking to, he sounded like a Caucasian elderly white male. When I specifically mentioned that to him, he said he doesn't care if it's Ramadan or Halloween. I think he needs to be retrained, with all due respect.
No, I agree. That was inappropriate. So I might have spelled your last name incorrectly. Fouad?
Yes.
I'm not finding a complaint in our system from you previously. What facility is it again?
So there was complaints that I had to file when I was in South Florida pertaining to the death of my son. My son was killed at the HCA Northwest Medical Center in Margate, Florida. And they harassed me. They even went as far as extorting me and unethically hacking my phone and so many different things. Harassed me physically, assaulted me physically. They put me in situations to try to injure me and make me sick and get me in trouble, all out of a desperate defense for obviously my opposing counsels, because I reported them. And they were well aware that I had clear and convincing evidence proving my complaint far beyond a reasonable doubt. And they attempted to extort me to try to not get in trouble. It started there. That was on January 27th, 2015. And it continued. And then on August 7th, 2018, I had to file another complaint about the Jackson Memorial Hospital in Miami after I was intentionally aggravatedly assaulted by Officer Ronnie Rodriguez from the City of Miami Police Department, because I told his supervisor that Officer Ronnie Rodriguez pushed me in my chest 3 times. And when I asked him to call a supervisor after he did that, he wasn't willing to call a supervisor until I started recording him with my camera phone. And when he saw me recording him with my camera phone, that's when he called the supervisor. And when the supervisor arrived, I told his supervisor. And when I told his supervisor, Officer Ronnie Rodriguez snuck up behind me. He put me in a chokehold. And then he twisted my neck to the right on purpose, attempting to break my neck. The 5th time, I struggled to say I couldn't breathe. And then he picked me up and he body slammed me onto my left side. And then he arrested me and falsified the police report and said he arrested me and brought me to Jackson Memorial Hospital because I was walking into traffic. And that's a lie. And after he physically assaulted me and arrested me, the supervisor immediately left. And then there was a PRI officer that arrived named PRI Officer Leslie Diaz. He immediately arrived and confronted him and said, "Why did you beat him up?" And then Officer Ronnie Rodriguez tried to convince him to help him take me somewhere and beat me up more. And that's when PRI Officer Leslie Diaz told him to take me to the emergency room. And when they brought me to Jackson Memorial Hospital's emergency room, Jackson Memorial Hospital purposely did things to try to cover up the case. And as soon as I got there, I called 911 from the hospital phone in the first floor psychiatric unit lobby. There's like an entrance through the back of the hospital there that they brought me to. And I called 911. I told them exactly what I just told you. And I told them also that the supervisor, Sergeant Edwin Gomez from the City of Miami Police Department, witnessed the attempted murder by Officer Ronnie Rodriguez. And they told me that they're going to send the rescue team to take me to the emergency room side of the hospital because I have serious neck injuries and back injuries and injuries to my lower extremities. And when they walked in with the gurney for me to sit on so they could take me to the emergency room side, several doctors and nurses came out of several doors and started yelling at them and told them, no, you can't help him. And they started scaring them and forced them to leave. And then 10 doctors and nurses, from what it looked like, they surrounded me and forced me into a little room. And they told me to pull my pants down and that they were going to inject me with something in my rear end to make me go to sleep. And I told them, no, I don't agree to that. And they said, if you don't pull your pants down, we're gonna pull your pants down and forcefully inject you. And that's what they did. And then they slammed the door in my face after they injected me, and I ended up passing out in about 30 seconds onto the little mat there that they had in the room. And then after that, when I woke up, I called 911 again from the hospital phone.
And this was in, sorry to interrupt, this was in 2018?
Yes, specifically August 7th, 2018. The attempted murder happened at approximately 9:30 p.m. By the time they brought me to the emergency room, it was probably August 8th, early morning, 12 a.m. or 1 a.m. approximately. And when I woke up from whatever they injected me with, I called 911 again from the hospital phone. And they said, okay, Omar, we're going to send the internal affairs to the hospital now. And they sent the internal affairs to the hospital. And by that time, they brought me upstairs. And the internal affairs came to take pictures of the visible injuries on my body. They took pictures of visible injuries on my ribs, fresh wounds from when the officer picked me up and body slammed me and his duty belt gashed into my left ribs. And then the visible wounds on my knees from when I was on my knees with my hands in the air and he was choking me from behind and then twisting my neck. There was several scrapes and cuts and fresh wounds on my knees. They took pictures of that. And then they took pictures of my entire body. And then they told them to do CT scans and x-rays. And then they brought me up to a different floor of the hospital. I think it was another psychiatric unit, but it was like it had several rooms with beds and bathrooms in it and like a living area. And they had me there for 10 days. And the 10th day that I was there, they had a court hearing with the Honorable Judge Alvin Balenta Jr. And they had two public defenders representing me. Public defender Julianne DeMaria and public defender Hugh Keoth. And the judge and the two public defenders both agreed that I didn't do anything wrong. I was beat up by the police, and they need to immediately release me from that hospital jail setting. And the prosecutor that was there, her name was Prosecutor Lourdes. And then there was about 10 people with white coats standing around us while we were sitting at a table, and there was a microphone in the middle of it, and the judge was sitting on the far end. Once they released me from there, I filed the complaints at the Miami-Dade County Courthouse. And once again, they started harassing me and purposely putting me in situations to try to, scare me out of continuing to complain and obtaining justice and monetary relief. And then it continued to happen again. They continued unethically hacking my phone and making it difficult for me to go to work. They started harassing me at work. Then I had to file another complaint against the transportation, Uber. I filed a complaint against transportation and found out that they were conducting a scam with Uber and JP Morgan Chase Bank. I had to file a complaint against JP Morgan Chase Bank. They agreed to settle with me out of court. When I went to the specific location that the law firm was at that was representing JP Morgan Chase Bank, Homer, Bonner, and Jacobs, to give them the settlement documentations that they asked me to sign, and they mailed them to me overnight rush delivery. They called the police on me and told them that I was trespassing. And two Miami-Dade police officers, Officer Brogdon and Officer Brown, physically assaulted me and injured me and falsified the police report and said I was trespassing and resisting arrest without violence to their person. And all I did was just ask them for their names and badge numbers before I entered the parking garage to obtain my transportation to leave. I had parked my bicycle against the hook on the wall in the parking garage, and immediately before I entered that parking garage, which is downstairs outside of the building, they physically assaulted me and then falsified the police report. And then from there, I went and reported that to the Miami-Dade County Courthouse, and they ended up shutting down the government, and they said it was a coronavirus pandemic. She hung up the phone.
Thank you for calling the Agency for Healthcare Administration. This call may be monitored for training purposes. Please listen carefully to the following updated options as they have recently changed. You will have a number of options to choose from. All of our agents are currently helping other individuals. Please stay on the line and we will be with you shortly.
Thank you for calling the Agency for Healthcare Administration. How can we help you today?
Yes, I was just speaking to the supervisor. She identified herself as Michelle Hart, and the phone hung up.
Okay, just give me one moment.
Hey, Michelle, the phone hung up.
Yeah, it was weird because I was still connected to the line. Your voice went away, but and then someone just notified me that you called back. So I don't know what happened.
Yeah, I don't know why the phone hung up. I didn't hang up on my end. But so back to what I was
Yeah,
saying.
it wasn't hung up.
Say that again.
Okay, so what is your complaint about?
Yeah, so it's everything that I was trying to sum it all up, because as I was saying, it's reoccurring, and that's why I wanted to speak to somebody in person, because when I tried to file the complaint through the website, as somebody told me to do years ago, and I filed the complaint also over the phone, it got worse. So that's why I wanted to speak to somebody in person so I could, show them my ID. They showed me their ID so I know who exactly, I'm talking to and who exactly is helping me, because every time I filed those complaints through the website and on the phone, I never knew who I was talking to. And, that opened the door to them being able to extort me and reoccurringly be able to get away with 18 U.S.C. SS 1513, the retaliation against a victim, witness, and or informant statute, as well as the SS 766.110, the healthcare facility liability statute. And both of those statutes were reoccurringly happening and being violated over and over again from South Florida, and now it's continuing in Tallahassee. And it's, like, as I mentioned, it's causing my mom to cry. It's ruining the quality of me and my family's life, and it's causing us a lot of mental anguish. It's costed us a lot of money. It's costed us a lot of business opportunities, and it's costed us a lot of valuable friendships. So I'm trying to do everything I possibly could to finally eliminate the problem so it could stop, because it's not fair for me and my family, especially during the month of Ramadan, and I'm having to bring this to the attention of my family, especially my mother, and it's making her cry, and it's causing her to break her fast. And as I was mentioning, after the second assault on March 19th, 2019, they shut down the government, and they said it was a coronavirus pandemic. And I moved from Miami to Broward. And when I moved to Broward, I went to the hospital there. I went to Florida Medical Center, and I explained to them the exact same thing I mentioned to you. And they sent me to a housing location at 3101 Southwest 12th Place in Davie, Florida. And they had the entire place orchestrated with people there already ready to do the exact same thing. They purposely put me in situations to make me more injured. They purposely put me in situations to make it difficult for me to continue to try to obtain justice and obtain monetary relief. And they purposely put me in situations to make me sick. And from there, when I tried to complain, it got worse also. Now, from there, I moved to a different housing location when I went to Plantation General Hospital, because I ended up contracting Streptococcus group A at that specific location, 3101 Southwest 12th Place, because of the fact that it was an uninhabitable rental property that was also like a halfway house that the hospital send people to. And they sent me to a different housing location similar to that one, a 2350 Northwest 11th Street location in Fort Lauderdale, Florida. And it was almost the same thing. It was an uninhabitable rental property, and they had people there orchestrating another cover-up attempt and purposely trying to make me sick and more injured and making it more difficult for me to continue to try to obtain justice and monetary relief. So from there, after they did a surgery at Plantation General Hospital to remove the Streptococcus group A and sent me to the 2350 Northwest 11th Street location. I left that location and I went to Vero Beach, Florida, and I complained at the hospital there, and I tried to start working, but they started harassing me while I was working, and their harassment led to me getting injured. So I moved from Vero Beach, and I'm now in Tallahassee, Florida, and I'm even more injured. The original injuries happened on August 7th, 2018, when Officer Ronnie Rodriguez attempted to murder me because I told on him. And then it got worse from August 7th, 2018 to March 27th, 2019. And it's continuing to get worse. And I'm now in Tallahassee, Florida. And recently I was at the HCA Lake Jackson location, and it was an ambulance driver wearing a red shirt. He was an elderly white Caucasian male. He purposely hit me in the back while I was laying on the gurney very aggressively, as if someone was punching somebody in the back. And it hurt my neck much more worse than it already is now. I tried to file a complaint. They acknowledged the complaint. But I don't know, if they're going to actually help me in this situation. Because I was at the HCA Southwood location yesterday, and there was a woman there who identified herself as Paige. She was doing a CT scan for me, and she did the exact same thing. She very forcefully hit me in my back while I was laying on the table of the CT scan, and she very aggressively hit me in my back in the same way as if she was punching me in my back. And she was an elderly white woman. And I went to the HCA Southwood location from the dental office named the Smile Connection at the Bond Community Health Center Incorporated here in Tallahassee, Florida, at the 1720 Gadsden location. And while I was at the dental office, I started feeling really sick and dizzy, and my neck was hurting really bad, and I felt a really sharp pain in the middle of my spine, in my back, and I haven't felt that pain before. And also, as I mentioned, I started feeling really sick and nauseous and dizzy, and I was just sitting on the chair in the lobby waiting for the transportation to arrive from Humana Medicaid Motive Care Transportation. And while I was sitting there, the nurses that were behind the window, they said they were talking to each other, and they were looking at me, and they said, "What's wrong with him? Should we just kill him?" And then they start laughing as if it's a joke. So I called 911, and they brought me to HCA Southwood. And that's when, as I mentioned, the woman named Paige, she hit me in my back while she was doing the CT scan. And another thing, too, the doctor at the dental office there at the Smile Connection at the Bond Community Health Center, he scheduled a tooth extraction for me to remove my first molar because I have an infection underneath my first molar. The doctor himself, I think his first name is Ashok, Ashok. He's a dental director there. He was very nice, very helpful. And after he scheduled the tooth extraction, he immediately left. And I then went into the lobby, and I was waiting there in the lobby. I was the only one there. And that's when the nurses made that comment and said, "What's wrong with him? Should we just kill him?" And they started laughing about it. But the Dr. Ashok, if I'm not mistaken, his last name is Manocha, Manocha. He's a dental director there. He wasn't there to hear that because he immediately left after he scheduled the tooth extraction and did an x-ray and examined my teeth. But now I don't feel comfortable going back there to do a tooth extraction. I'm worried about that. And, it's an ongoing thing. I mean, from there I went to, as I mentioned, the HCA Southwood, and I was physically assaulted again.
And so what did they, do you know the results of your CT?
Yeah, they wouldn't tell me, nor would they show me the imaging. I asked them if I could see the imaging, and they said no. And so they gave me some pain medication through the IV. They said it was some Toradol, and they gave me something for nausea through the IV. But when I asked them if I could see the imaging so I could, see what's exactly wrong with me, they said no. So I said, how am I supposed to be able to verify, exactly what's wrong with me? And they said, oh, you could get your medical records and it'll be written in there. And I asked them, I said, well, the medical records, I mentioned to them rather that the medical records, it doesn't have the actual imaging. It just has notes and things that the doctor said of what the imaging looks like and things like that. And I noticed they always write that they look normal, and that's impossible because I have pain in my neck and my back. My hands and arms keep going numb. I've got pain in my head. I've got numbness in my upper and lower extremities, pain in my knees, my legs. So it's impossible that the CT scans and the x-rays look normal. And, if they look normal, they wouldn't be giving me pain medications, especially through an IV. It's just like, for example, when I was there and I told them I was feeling nauseous and they were witnessing me throwing up inside of a bag, they verified, okay, this kid's nauseous. We need to give him some medication for nausea because he's visibly throwing up. So it's the same thing. They're not going to administer pain medication if they're not, clearly aware that I'm in pain. And if they're telling me that the CT scans and the x-rays look normal, why would they administer pain medication? And I'm asking them if I could see the imaging myself, and they're telling me no. And when I enter the emergency room yesterday, the nurses at the triage desk immediately started conversating with the ambulance drivers and telling them that I'm here because of a lawsuit. So it's as if they're trying to, stonewall me and not tell me the necessary information that I need to try to, have a desperate defense from my opposing counsels once again.
So when were you discharged? Yesterday?
Yes, I was discharged yesterday, and the transportation from Humana Medicaid Motive Care brought me home. I think I was in the lobby there for about an hour. I was on the phone with Humana Motive Care for about an hour. They told me it would take 3 to 4 hours before the transportation arrives, but I explained to them that I need the transportation to be expedited because I need to go home as soon as possible to take my medication. And they asked me to tell the discharge nurse to call them from the hospital phone so they could verify that I'm being discharged. And the nurses said, no, we don't call the transportation. I have to call the transportation. And I explained to them that my health insurance company, Humana Medicaid, specifically requires a discharge nurse to call them from the hospital phone so they could verify that I'm being discharged. And so the discharge nurse could verify what address I'm going to, and my name, my date of birth, and my phone number. So they know that I'm the person that's being discharged and that I'm going to my house from the hospital. So the Humana Medicaid insurance could cover the cost of the transportation. And, that's one of my only resources right now because of the injuries that I sustained from Officer Ronnie Rodriguez on August 7th, 2018. I'm on Social Security disability income because of that, and I can't work. So that's one of my main resources to be able to get to and from doctor's appointments, specialists, hospital appointment, emergency room visits, any and all doctor's appointments. That's really my only resource to be able to get to and from there. And it's an ongoing problem also. Every time I have to go to the emergency room and I'm discharged from the emergency room, and I ask the discharge nurse or nurse at the emergency room to call 866-799-0565 so they could tell the transportation motive care through Humana Medicaid that I'm being discharged and I need transportation home. They turn it into like a theatrical event. They start arguing with me. They start acting irate, and they start trying to make me argue with them. And they tell me they're not going to call them. They're not going to be on the phone for 3 hours with them. And all it takes is literally 1 minute for them to verify what my address is, my name, my date of birth, and my phone number. And when I tell the Humana Medicaid motive care transportation that, they tell me their policy is that they have to have a discharge nurse call from the hospital phone to verify that I'm being discharged. So the transportation is covered through Humana Medicaid. And I tell the same thing to the nurse, that that's what Humana Medicaid motive care transportation requires, but they don't care. And it's as if I'm the referee between the nurses at the hospital after I'm being discharged and Humana Medicaid motive care transportation. And I'm stuck in the middle, getting beat up while I'm being a referee at the same time. It's not fair. And literally I was on the phone with them for an hour, and I was waiting to speak to a supervisor. And literally after being on the phone for an hour with one of the representatives from Humana Medicaid motive care, I realized that he was just patronizing me the entire time. And I hung up the phone to call back to speak to somebody else. And as soon as I hung up the phone, somebody walked in and said, I'm transportation for Omar. And I was sitting in a wheelchair holding my cane in front of the phone. And he walked in, went to the front desk there in the lobby, and he was literally a few feet from me. And I said, yes, I'm Omar. And he said, may I help you? I said, yes. And he identified himself as a Turkish Muslim. He said he was Muslim from Turkey. He didn't speak good English. But he said that he was the transportation to bring me home that day, which was yesterday. Say that one more time. Your voice is really low. Could you speak up just a little bit?
You mentioned that when you were at the HCA Lake Jackson location, an ambulance driver hit you. So who did you report that to?
I reported that to the HCA Lake Jackson directly on the Google reviews. Also, I reported that to Humana and Medicaid.
And did you get a response from HCA? I don't know that they respond to Google reviews.
Yeah, they responded to the Google review. They acknowledged it. Said, but as I mentioned, I don't know if they're going to help me or not. So, and the problem is reoccurring. So I'm trying to do everything I possibly could to eliminate the problem.
Sorry, I didn't mean to interrupt you. The ambulance driver is not an employee of the hospital. They're, employed by the city/county. So I didn't know if they referred you maybe to report your concern there.
Yeah, so...
Did anyone refer you there?
Say that again?
Did anyone refer you to report that to the county?
No, but they witnessed it. It happened literally right there on the right side of the nurses and doctors triage desk on the inside of the emergency room, when the area that people are brought in on the gurney. It literally happened right there on the right side of it, and the nurses and the doctors that were at the triage desk there, they witnessed that.
And then when you were at the Southwood location yesterday, and the page, I guess, hit you.
The exact same way. Yeah, the identically exact same way. It's as if, they were friends, both trying to retaliate against me, or possibly related. They kind of looked like, they might have been related, but they were both elderly white people. The woman Paige, who did the CT scan and the X-ray for me, she was an elderly white woman, and the ambulance driver who was wearing the red shirt, he was an elderly white male. And I'm noticing that all of these complaints, it's as if they're following me. They're aware of what I'm complaining every time I call 911, every time I go to a doctor or a hospital. And I'm noticing that they're all patronizing me, and they're doing things that are maliciously harassing. It's not just harassing it, they're maliciously harassing me. And they're trying to scare me out of complaining. And it's almost as if, they're trying to frame me in a sense, and they're trying to act like they're maliciously prosecuting me to try to scare me even more. But they're trying to do that, deceitfully and fraudulently to try to, not get in trouble for doing that. And that's the exact same thing they were doing in South Florida. And as I mentioned, it's ruining the quality of me and my family's life. It's costing us a lot of mental anguish. And it's making my mother cry. And it's costed us a lot of money. It's costed us a lot of business opportunities and valuable friendships. I literally ran away from South Florida to the middle of Florida and out of Tallahassee. And that costed me more than $35,000 just to do that. And that was $35,000 cash out of my own pocket just to get away from them purposely extorting me, unethically hacking my phone, maliciously harassing me, maliciously acting like they were prosecuting me. It's torture. They're literally torturing me. All because I did the right thing, which is report an officer attempting to murder me and reporting that they killed my son on January 27, 2015 at Northwest Medical Center in Margate, Florida.
And how did your son, what happened with your son?
The doctor failed to perform a timely C-section, and my son died. And there was reports that they weren't monitoring his stress levels, his heart rate, and it was a big problem. And my son died. My son's mother's name is Nur Clark. She's in the military. They awarded her approximately $5 million. And when I tried to obtain monetary relief, because they passed a law in the state of Florida stating that it's unconstitutional to put a price on a child's life in the state of Florida that dies due to medical malpractice, which is exactly what happened to my son. And all of these surviving parents and heirs are entitled to compensation. So I tried to file a claim on my behalf and for my family, and they started extorting me. And they started maliciously harassing me. And they started acting like they were maliciously prosecuting me. And they tried to do that deceitfully and fraudulently. And that happened in Broward on January 27, 2015, when my son died. And it continued for several years while I was in Broward. And from there, I finally moved to Miami to try to start a new life. I started working there in Miami, and they started harassing me there also while I was at work. People tried to rob me at gunpoint. Customers would come in there and spit in my face. Somebody went as far as writing my deceased son's last name, Clark, and my son's mother's last name, Clark, on the counter where I work, trying to, maliciously harass me once again. It was an ongoing problem, and I reported it. I filed several trespassing citations against the people who were doing all of those things. And then I went to work one day, and the person who owns the store, he identified himself as Ahmed Jabber. He told me that somebody came to the store and said they were going to kill me if he doesn't fire me. So I said, okay, well, just call the police like I did. And he said, no, I have to fire you. I said, okay, well, may I have my overtime? Because I was working almost 18 hours a day, 7 days a week, sometimes 24 hours a day because he wouldn't show up. And I asked him for my overtime because I was working there for several months and he wasn't paying me my overtime. And he said, no, he's not going to give me my overtime. So I said, okay, well, you'll be hearing from my attorneys. And then I left. And when I left, I called my mom, and she didn't answer the phone. So I sent her a text message and told her what happened. She told me to call the police. And when she told me to call the police, I was literally standing in front of Publix. That was approximately 2 2 minutes walking distance from where I was living in Miami, and there was a police officer standing outside of Publix, across the street from Publix, and in his car with his door open, and he had his foot on the ground. So I asked him if I may approach him. He said yes. I told him what happened, and I asked him if he could call my mom, so she doesn't worry as much. And he called my mom. She didn't answer. And then he ended up pushing me in my chest 3 times. And I asked him, could you call us? I immediately put my hands in the air. I said, could you please just call a supervisor? And he wasn't willing to call a supervisor. And that's when I started recording him with my camera phone. And when he saw me recording him, that's when he called the supervisor. And like as I mentioned, when the supervisor arrived, I told the supervisor what he did. And that's when Officer Ronnie Rodriguez snuck up behind me, put me in a chokehold. I said I couldn't breathe 5 times. I struggled to say I couldn't breathe. And then he twisted my neck to the right the 5th time. I said I couldn't breathe. Then he picked me up and he body slammed me onto my left side. Then he arrested me and falsified the police report. And then he brought me to Jackson Memorial Hospital. And everything that I mentioned to you already happened after that.
Well, I can tell you've been through a lot, so I'm very sorry about everything you've been through.
Thank you for your concern. It's now 2025. Today is Friday, March 21st, 2025. It's 3:38 p.m. in the afternoon. This has been happening since January 27th, 2015, since my son died at 8:35 p.m. that night at Northwest Medical Center in Margate, Florida. And I'm being tortured. I've been being tortured. I've been tortured since then. It literally feels like torture. I'm having difficulty sleeping. I'm always in pain. I'm having difficulty breathing. I'm having chest pain. I'm always feeling sick and nauseous. I'm getting maliciously harassed. I'm always getting patronized. I'm always being put in situations to try to frame me, to try to make my opposing counsels look better, and then trying to make me look worse, as if I did something wrong. When I came to Tallahassee, Florida, I immediately enrolled into college to try to get my law degree and my medical degree, because I couldn't find a lawyer to help me, and I couldn't find doctors to help me. So the only thing I could think of was to learn how to be a lawyer and learn how to be a doctor myself, so I could at least try to, save my family, let alone myself. And I ended up having to take a break from school at Tallahassee Community College because I was in too much pain when I was sitting in the class. My hands and arms kept going numb. My neck kept hurting. My back kept hurting. My legs kept going numb. I kept feeling sick. I had to go to the emergency room several times. And the Tallahassee Community College told me to report that to my doctor's office. I reported to the doctor's office. Tallahassee Community College said they're willing to provide me extra services because of my injuries to help me graduate and learn what I need to learn so I could graduate. I mean, it's been verified on every possible level by several participating agencies. And the problem is still reoccurring. That's one of the main reasons why I was asking if I could speak to a supervisor there to, speak with them in person so I could show them my ID. They show me their ID, so I know exactly, who's helping me, and we try to eliminate the problem once and for all. And I mean that from a perspective of me and my family, because this problem, I'm sure it's happened to several other families and several other people. But my main concern is me and my family right now, because it's ruining the quality of our lives, let alone our peers' lives. I could imagine, our peers, what they're going through, and, them worrying about them being retaliated against just because they're our peers. It's just like, for example, you're a supervisor there at the Agency for Healthcare Administration. I'm sure, you're expecting a pension. You're depending on your job to, be able to provide for yourself, provide for your family, and afford your necessary living necessities at the least. And, I'm sure, you have things that you want to accomplish in life, and, you have money being put towards that, and you're really dependent on, your job. And, you can't afford to lose your job. And, there's several people in those types of situations at several necessary living necessity locations that people have to complain to or go to for help. Like myself, me calling the Agency for Healthcare Administration and speaking to you right now. And, considering everything I just told you, you might be worried about being retaliated against for helping me. Because, once again, you're dependent upon your job. You might be worried about being fired. You might be worried about being harassed. You might be worried about being physically assaulted, all because you helped me. And that's not fair for me. That's not fair for you. And it's not fair for people who are, in positions or working at necessary living necessity locations that people have to go to for help. So I need the problem to stop, and I'm trying to find out the best way possible to do that.
Like I said, our agency licenses the hospitals, and so we take complaints, about the care that's provided in those facilities. There aren't requirements for everything that happens, as far as care. So what we could do is take the complaint and review it for possible violations, and then let you know, after our assessment, what you could do. There is, I wondered, because of all the things you've been saying, I wondered if you had ever been in contact with the Department of Health and Human Services, the Office for Civil Rights.
Yeah, I reported this situation to the Department of Health in South Florida, the Department of Health in West Palm Beach in South Florida also. I reported it to...
I'm talking about the Federal Health and Human Services Office.
Yes, I reported to federal participating agencies. I reported to the FBI directly. I reported to federal courthouse. I reported to county courthouses in South Florida as well. I reported to the White House also during both the Biden and Trump administration. And the problem is recurring. It's literally turned into a situation where I'm legally incapacitated now. Mentally, physically, and legally. I literally had to have my father, Mohsen Fouad, who retired from the Broward Sheriff's Office after 30 years of service. I had to have him file a petition on my behalf because I'm legally incapacitated. And I had to appoint him as my guardian to qualify for what they call equitable tolling in these types of cases. Equitable tolling is where they remove the statute of limitations. And that had to be done because I'm legally incapacitated. I'm not able to continue to go to the courthouse and continue to try to get justice and monetary relief. And I wasn't able to do that within the statute of limitations because of everything I just mentioned to you. And they asked me to have a guardian file a petition on my behalf for adjudication of legal incapacitation and to appoint them as my guardian because that's what they ask for people to do in these types of situations. So I did what they told me to do. And now my father, he recently had foot surgery and his leg is in a cast and it's going to be in a cast for 6 months. And I just recently saw a news report where Trump said he's shutting down the government for 6 months. And that was after I reported that my father had foot surgery. My father had foot surgery and his leg is going to be in a cast for 6 months and he's in a lot of pain.
So you think that's related?
Of course.
When when you said you got the Google, when you filed the Google review and they responded, what did they tell you?
From what I remember, they told me that they acknowledged the complaint and that I think they said they were looking into it. I think there was a number there that they asked me to call. Let me look at it again.
Every hospital has a patient safety liaison, or sometimes they call them the risk manager, where people, if they have concerns, they can talk to them about it, and they'll look at, the hospital system to see if there's something they need to improve upon, or, interview other people and to see what might have happened and how to, do something again. So I would definitely urge you to talk to them. If they gave you a phone number to call, then you should do that.
Yeah, they specifically said. Yes, they specifically said. This was 2 weeks ago. It says HCA Florida Lake Jackson Emergency Room owner. And then it says, Omar, thank you for your feedback. We are sorry that you had a negative experience. While we are unable to discuss specific concerns publicly due to privacy laws, we would greatly appreciate the opportunity to discuss this with you offline. We would like to speak with you personally. Please call our patient concerns line Monday through Friday from 8 a.m. to 4:30 p.m. at 850-325-5860. We hope to hear from you. And this is after I wrote complaint, semicolon, Humana Motive Care Medical Transportation. Said transportation is scheduled for 7:30 p.m. approximately to bring me home from HCA Lake Jackson after making me argue and repeat that they want the discharge nurse to call them from the hospital so Humana Motive Medical Transportation could send transportation after being discharged from the ER. I told the discharge nurse that, and they started arguing with each other, saying I'm not calling them because they don't want to be on the phone for 3 hours with Humana Motive Care Medical Transportation. Then they sent the discharge nurse back and forth to my room to tell me that and asking me to call them. And if they need to talk to the nurse, I could call them from my phone and they could talk to them from my phone. But they can't call themselves from the hospital phone. I asked to speak to the supervisor at the ER, and then all of a sudden, Humana Motive Care Medical Transportation said they'll send transportation in approximately 3 hours, and is that okay with me? I said, no. Could you please tell them to expedite the transportation because my legs are going numb and my neck is hurting. They said the transportation might arrive sooner and if an Uber or a Lyft is okay. And then they said, do I need help getting in and out of the vehicle? And the nurse said yes, and that I have a cane. They purposely patronized me and harassed me the same way they always do every time I am discharged from the hospital ER when I ask them to tell the discharge nurse to call 866-779-0565 so they could send transportation for me to go home from the ER. Sincerely, Omar, Mohsen, Ibrahim, Fouad, 5:04 p.m., Wednesday, March 5th, 2025, Tallahassee, Florida. And I put a picture of me at the ER crying after this happened.
Well, I know they don't, what they said, they don't want to talk about it back and forth on Google Review. That's not something they're allowed to do. And so if you could call them and express, what happened and, let them work through that and make sure it doesn't happen again. Maybe that next time you walk in there and you need them to call transportation, they have a way to handle that for you and other people who did.
Yeah, I noticed that's what they did yesterday. But I called there several weeks ago, and I told them specifically the time that I was assaulted by the ambulance driver at the on the right side of the triage desk at HCA Lake Jackson. And they said they were going to review the cameras and all of those things. And they never called me back after that. And I also, reported to them that there was a different nurse. I mean, that also was a similar situation to another emergency room visit at the Tallahassee Memorial Hospital location here in Tallahassee, at the Bixler emergency room location. There was a nurse there named Nurse Christopher who was doing an EKG on me. And I was being discharged from the emergency room also, and I asked him specifically the same thing. If could he call 866-779-0565? And he wasn't willing to, but I told him that's what they require. They require a discharge nurse to call them so they could verify that I'm being discharged so the insurance could cover the transportation. And he told me to call them from my phone. So I called from my phone, and they asked for him to call from the hospital phone. And then finally they just got tired of going back and forth, so they were talking to the discharge nurse from my phone, and they were asking the discharge nurse to verify my information, like, for example, my address that I'm going to, my name, my date of birth, my phone number, and he didn't know any of that information. And he told me to just tell them my information. And literally, when I told him my address, and I said my address, and then when it got to my zip code, and I said 32303, literally when I said the word O, he very forcefully grabbed a handful of all of the EKG wires that were attached to my chest and my shoulder and my neck area and snatched them all off. Literally as if he was, as if somebody would, the same force as if someone was punching somebody. That's the amount of force that he used. He just snatched them all off at once, and it gave me like a whiplash, and it hurt my neck. And he was a very big, muscular, strong man. He looked like he was about 300-pound, muscular, bald head, black male. And, he was being very intimidating and irate. And then after he did that, all because I said, "Oh," when I said 32303, he wheeled me out. He did what I just mentioned to you. And then he wheeled me out in a wheelchair to the lobby. And I was waiting for the transportation. And he wheeled me right in front of on the side of the nurse's desk there, out of the way of, everybody who would walk in. And I asked the nurses at the front desk, "What is that nurse's name?" to verify. And they said his name is Christopher. I said, "Okay, well, he just physically assaulted me." And when I told them that, they tried to trespass me from the emergency room because I told on him. And so I called 911, and I was on the phone with 911 while I was reporting that on the side of the nurse's triage desk at the emergency room. And the 911 person who called me back after I called 911, they called me from a regular number, or I think it was an unknown number, but they called me back, and they could hear the nurses at the front desk there being very irate and disrespectful to me. And all I was doing was just reporting the nurse physically assaulting me. And I had her on speakerphone, the 911 person who called me, and she was verbally telling me to let them talk to her because they shouldn't be talking to me like that. And they finally the police officers arrived. When the police officers arrived, it was a female police officer, and she took the side of the nurses, and she didn't care. She acted like she was just trying to be cool and fit in with them. And she said she was going to trespass me, and I said, "But you can't trespass me for a false accusation. They're lying to you, saying that I did something wrong, and I didn't. All I did was ask them for the nurse's information so I could verify the nurse's name that physically assaulted me so I could file a report properly." And even the 911 person who called me back verified that they were talking to me very bad. And so I asked to speak to a supervisor because I told the officer that she can't file a trespassing citation on behalf of the hospital for a false accusation. And she said she could do whatever she wants, and the hospital could do whatever they want. And that's not true. So I asked to speak with a supervisor. A supervisor arrived, and the supervisor told me they can't trespass you for no reason. And you were brought here in an ambulance, and you're just waiting for your transportation. And while you're waiting for your transportation, you were physically assaulted by a nurse. And all you're trying to do is just report that while you're waiting for your transportation. They can't trespass you for no reason. Now, while I was waiting after I filed that complaint with the supervisor, also, I started having chest pain. And the police officers that arrived agreed to drive me to HCA Lake Jackson emergency room. So from Tallahassee Memorial Hospital, they drove me to HCA Lake Jackson because for some reason they couldn't get an ambulance to transport me to HCA Lake Jackson because I was already at Tallahassee Memorial Hospital emergency room. And every single time I go to the doctor or the emergency room, they ask me, why is your neck injured? Why is your back injured? What happened to you? Who injured you? And I tell them the truth. And they start retaliating. They start retaliating against me and harassing me. And then I noticed that kept reoccurring, and I obviously had to continue going to the doctor because I needed to fully recover, obtain justice and monetary relief for myself and my family. And the doctors or the emergency room personnel would ask me, how did I get injured? Who injured me? What happened? And I wouldn't tell them. And I would just say things like, for example, it's a long story. They won't help me. And they would harass me. So, it's torture. I literally feel like I'm being tortured.
Very sorry for, how you feel. I would definitely follow up with the hospital. This, like I said, this agency, we license the facilities, and there are general care rules they have to follow. But what you're describing is not. We don't really intervene for patients, and we don't have any control over what happened, with the police and everything that happened in the past at other facilities. So it's hard. It's hard for me to say that we can really do anything for you to, like you said, make it stop. But I would definitely follow up with each hospital when something happens. Contact their patient liaison and express, your concerns with your experience there so that they know, because they're not everywhere in the hospital, so they don't know what happens unless somebody tells them about it. And so, if you can do that, then that will help them make your next experience, and you said you go there, quite often, make it better for you and for other people.
Yeah, so I tried to do that, as I mentioned, with the situation at Tallahassee Memorial Hospital. After returning home, after the situation with them trying to trespass me and the officers transporting me to HCA Lake Jackson because I was having chest pain after that, I reached out to Tallahassee Memorial Hospital and asked to speak to a supervisor there so they could review the cameras. And I told them specifically exactly what day and time it happened, the name of the nurse. I gave them all the necessary information they needed. They asked me to send them that information on an email to the security supervisor who's in charge of the cameras there. I did all of that. And then I finally was able to get in contact with the specific person who they said I sent the email to, the security camera supervisor there. And I told him the same thing. Everything I just mentioned to you, I mentioned to him also. So he's fully aware of the severity of the situation. And he said he's going to review the cameras and everything. And they never called me back after that. And then
Sometimes it takes time.
it shouldn't take that long to review some camera footage. But after that, they they told me when I called the police department and asked to speak with the internal affairs, because the first officer that arrived, the female officer, tried to falsify a trespassing citation and a police report. And I told him, that's official misconduct. She's not allowed to do that. And she told me, her supervisor at the internal affairs told me that she wrote on there that she trespassed me, and she didn't even specifically put what happened. She purposely wrote it in a way to make it look like I did something wrong. And I was the one who called the police first. But regardless of that, she told me that even though I'm trespassed, I could still go to the emergency room if I need to go to the emergency room. So they're putting me in situations as if they're maliciously harassing me, maliciously prosecuting me, and it's causing me and my family a lot of problems. I'm having difficulty breathing, getting chest pain. I'm already physically in pain. I have several neck injuries, back injuries, injuries to my upper and lower extremities. And them doing those things it's causing a lot of problems. As I mentioned, it's ruining the quality of me and my family's life. It's making my mother cry. It's causing my mother to have to break her fast during the month of Ramadan. And I have to report these situations to my mom and my family for their safety. I don't know if you're familiar with iPhones and the iCloud. There's, for example, the iCloud, you could get, I think, 2 terabytes of memory in the iCloud. And that was several years ago. So I purchased 2 terabytes of the iCloud iPhone storage to be able to document all of what was happening in real time, step by step, as it was happening from South Florida and now to Tallahassee, Florida. My first iCloud is full, 2 terabytes of memory of screenshots and documentations and complaints and videos and everything that a person could look at and say, yeah, that happened. I had to purchase another iCloud, and that iCloud is almost full. And I purchased an iPhone 14 Pro Max with 1 terabyte of memory on the iPhone itself, and that is completely full. And literally yesterday, from the emergency room, while I was at HCA Southwood, I had to purchase 6 more terabytes of iCloud storage, because when I tried to back up my iCloud while I was at the HCA Southwood location, it said I don't have enough memory in my second iCloud. So I have to get more iCloud storage. And then the next option was 6 terabytes of memory for $30 more a month, or 12 terabytes of memory for $59.99 a month. So I already can't afford another $30 a month on top of the $9.99 that I'm already paying for every month for my first iCloud that's already full, just to be able to keep that documentation on top of my $50.49 phone bill. and I'm on Social Security disability income. Literally every single penny that I have is accounted for. I'm literally having to sacrifice, my necessary living necessities, like my hygiene products, my food, healthy food, things that I need to live, specifically my necessary living necessities. I'm having to sacrifice those things just to be able to continue to document all of these complaints. I tried to reach out to an attorney by the name of Muhammad, what's his name? Shibli. I think it's Shibli Law. It was a Muslim attorney. I couldn't find, an American attorney or a non-Muslim attorney to help me. So I figured, okay, maybe I could reach out to a Muslim attorney's office to help me. So I reached out to Shibli Law. I think his name is Hassan Shibli. I reached out to Shibli Law, and they said they would help me. So I told them everything I just told you, and I found another attorney who was willing to help me with one of the police brutality cases that happened on November 23rd, 2021 in Broward County. And he wanted $15,000. He wanted $1,500 a month for 10 months for him to help me. I told him I couldn't afford that, but I had $1,500 cash to give him right then and there. So I gave him $1,500 cash in an envelope. And him and Hassan Shibli both tried to extort me. Specifically, what I was mentioning to Gary Printy in person about what happened in the case, and specifically what I told him in writing when he told me to answer the answers to interrogatories from my opposing counsels, I specifically told him exactly what happened. Everything I just mentioned to you. And I told him, it's costing me a lot of money, as I mentioned to you, to move from South Florida to Tallahassee, Florida for my safety. Told him all of those things. And then I said, when I sent him the emails to the answers to the interrogatories, I told him the same thing in person also. He tried to reply with an email acting like he didn't acknowledge anything that I told him in person or in writing in the email. That was both sent to my opposing counsels and him. And then all of a sudden, the Muslim attorney, Hassan Shibli, said he's not going to be able to help me. And he needs $30,000 a month just to run his law firm, and he's not running a charity event. And then he starts posting videos of him going to gatherings with people who I used to work for who didn't pay me my overtime. Specifically, not Ahmed Jabber, another person named Amjad Hamed. I worked overtime at his stores. At that time, I was only working 12 hours a day, 7 days a week. But I worked there for several months, and they never paid me my overtime. And it was at several different stores of theirs that I worked there for several months, for years, and they never paid me my overtime. The same way as the store in Miami that was owned by Ahmed Jabber. And he started posting videos of events that he was going to that they had, that Amjad Hamed had, and they had like booths and things set up where they were selling food and things like that. And he was showing that he was going there and buying food and all that, acting like he was friends with them. And then he was showing videos that he just received, $1 million from a charity and things like that. And that was literally immediately after he told me he's not going to be able to help me. And that was immediately after Gary Prenti tried to act like he wasn't acknowledging what I was writing in the answers to interrogatories or telling him in person. And then they both started stonewalling me, and, they were both doing the same thing. And they were both in communication with each other because I told them both about each other, that, Gary Prenti was helping me and Shibley Law was helping me. So they were obviously in contact with each other. And they both have a law firm in Tampa. And Gary Prenti has a law firm in Tampa and in Tallahassee. And now, because they did all of that, I had to have my father file a petition on my behalf because I'm legally incapacitated, mentally, physically, and legally. I'm not able to obtain justice or monetary relief for myself because I can't keep going to court. It's traumatizing me, and I'm in a lot of pain. I literally feel sick just talking about the situation. Let alone the fact that my hands and arms are going numb when I'm just trying to document these things. My neck is hurting, my back is hurting, my legs are going numb. And you mentioned that you're the supervisor there or one of the supervisors there at the Agency for Healthcare Administration, right? So, if you could document what I mentioned to you and, put that it's urgent, hopefully, counter surveillance or, your supervisor will acknowledge that as soon as possible and say, hey, man, this kid really needs help. Everything he's telling us is true.
Yeah, I can tell, you've gone through a lot. Sorry about that.
Yeah, that's the exact same thing they told me when I went to the Tallahassee Memorial Hospital and mentioned all of this to them. And I told them I need to speak to somebody about this because I feel like I'm going to die. I honestly feel like they're going to end up killing me. And I honestly feel like that's what they're planning to do, deceitfully and fraudulently. And when I went there, they had me there for a few days, and I spoke to a group of people in a room. It was a slim elderly white woman and several other people sitting in that same room. And the slim elderly white woman, she said the exact same thing. She said, "You have been through a lot."
I do hope it gets better for you. And, keep reporting, when things happen. Keep letting the management know in those facilities so that, they can take a look at their process and make it better. They don't know unless you tell them.
I'm starting to notice, though, that there is some kind of counter security. Pretty much, for example, if they have somebody surveillancing something, they have also counter surveillance, people who are surveilling the people who are surveilling. So I'm starting to also kind of notice that type of situation is happening, but I don't trust it, because what's obvious to me is that it seems like as if they're trying to deceitfully plan, plot, and strategize how they're going to frame me to make my opposing counsels look better and make me look worse, as if I did something wrong. And that's been the situation since South Florida. That's what's been obvious to me. And, once again, I'm, as I mentioned, I'm concerned that that's what they're plotting, planning, and strategizing to do to eventually kill me.
I think, if you think they're doing that, I guess just, be real careful about what you do so they can't use it against you,
Yeah, that's one of the main reasons why I was hoping I could speak to a supervisor at the Agency for Healthcare Administration in person, so I could at the least show them my ID. They show me their ID. We sit down, write the complaint, and take whatever necessary steps from there to finally eliminate the problem.
Right. It's just that we're not able to intervene for you like that. That we regulate the facilities, and it's really like in hindsight, there's nothing we can do to, escort you, stop things from happening. And, coming here to talk to somebody in person is not going to change what we're able to do as an agency.
I mean, well, if I
In touch with your Medicaid. You said you have Medicaid in Indiana. You have a caseworker, right?
I honestly don't know.
Okay.
I asked them several times for a case worker or case manager and their number. And from what I remember, when I would call the number that they told me to call, they wouldn't answer the phone. So I would leave a message. They wouldn't call me back. And I remember finally I was able to get in contact with somebody on the phone, and she was just like a irate, rude, ghetto black woman. She was talking like she was just like an uneducated child from the ghetto, and she seemed like she didn't care at all to help me. And I asked for a different case worker or case manager, and then they had another person, from what I remember, who I spoke to. He sounded like a homosexual, ghetto, uneducated black male. And it was the same thing. He was just talking to me, as if he was just some rude ghetto child. who was uneducated and homosexual. And I reported both of them because of, the severity of the case and the fact that, I need quality preventative care, not, I don't need to be tricked and manipulated or taken advantage of. So from what I remember, they said they were going to try to get another case manager or caseworker, but they never called me back. And then I noticed they tried to act like we didn't have those conversations. And they had that same ghetto black girl who I mentioned to you about before, the black homosexual male. I noticed that they would have her get on the phone several times after that when I would call to complain about something. So it's like they don't care. It's as if they don't care about what I'm complaining to them about and reporting to them about. And everything I'm telling them is true.
Sorry you had that experience.
It's just like, for example, if you have a child, and you treat that child very nicely, you talk to the child very calmly, you're very patient with the child, that child or that baby is going to grow up to naturally be calm and gentle and patient and soft-spoken. But if you talk to a child or a baby irately and very aggressively, and that child is naturally going to grow up to be irate and aggressive, and it's the same thing. So if you were one of those types of people and you got on the phone and were just careless and irate and acting erratic and going crazy on the phone when I'm complaining to you, it's natural for somebody who's complaining to react the same way. And that's what they've been trying to do. That's what they've been trying to get me to do, just so they have a desperate defense for my opposing counsels, once again, to try to make them look better and trying to make me look worse. That's what they've been trying to do. And I don't know what else to do to bring that to the proper people's attention. I've documented it on several iClouds. It's costing me a lot of money every month. I've reported it to the FBI, local police departments, state and county, several police chiefs, several internal affairs offices for several police departments and police offices and sheriff's offices, rather. I've reported it to the DEA, the White House. I reported it to the CIA. I reported it to several participating agencies. I reported it to several healthcare agencies. I don't know what else I could possibly do. I've even reported it to participating agencies out of the state of Florida. I've reported it to participating agencies outside of the United States of America. I reported it to every single participating agency and every single agency or location that helps people in these types of situations. And they're still deceitfully and fraudulently, maliciously harassing me, extorting me, and acting as if they're maliciously prosecuting me. And they're doing all of those things as if they think they could get away with it. So that tells me that they have done this to other people and that they have experience in doing these types of things to people. And they are obviously aware of, people who don't have much resources, what they're able to do and how much they could endure after complaining and being maliciously harassed and deceitfully and fraudulently conspired against and manipulated and maliciously acted as if they're being maliciously prosecuting people to scare them out of complaining. They're well aware of, what a person is likely to do after they've complained so much and they're not getting help. They're well aware of people who don't have much resources, what they could afford to do, who they could go to for help, what's going to populate on their Google search, all of those things. Let alone the fact that they're able to unethically hack people's phones.
Do you have like, I know you said you moved. Do you have a counselor locally?
Say that again?
Do you have a counselor that's local?
I don't. I've been trying to schedule talk therapy with somebody to document this more than it's already been documented. But that's been a problem. I mean, first it started off when I was going to the Florida State University Primary Health at the 2911 Roberts Avenue location here in Tallahassee, Florida. And I would have to go there to schedule appointments to specialists that I need to go to and doctor's appointments that I need to go to. And the Humana Medicaid Motive Care Transportation was sending me unsanitary transportation vehicles. Sometimes the vehicles would have filthy seats. Sometimes the vehicles would smell toxic and have filthy seats. And once they were noticing that I was complaining about that and I was documenting that, they started doing things to make it difficult for me to document. Like, for example, they would then send a vehicle that didn't look like it had dirty seats, but the vehicle would smell contagiously toxic. And it would make me sick literally just from opening the door. And that's difficult to prove by just recording with a camera phone. You understand?
Yeah.
And they started doing things like that. So, yeah, they're deceitful, as I mentioned to you, they're deceitfully and fraudulently, maliciously harassing me. They're unethically hacking my phone, and they're doing all of those things out of a desperate defense from my opposing counsels because they're aware that I have clear and convincing evidence proving all of my complaints far beyond a reasonable doubt, and beyond a preponderance of evidence. And all I need is clear and convincing evidence proving my complaints beyond a preponderance of evidence to be able to obtain justice and monetary relief. But I have clear and convincing evidence proving all of my complaints to an extent of proving them beyond a preponderance of evidence to being able to prove them clearly and convincingly far beyond. So it's irrefutable. There's no way they could justify a beating. And there's no way they could justify the fact that I've complained every step of the way from South Florida to Tallahassee, and I've been able to prove all of my complaints. I've been able to prove every time I've complained, I've been able to prove that each and every single one of those situations were urgent and necessary for me to complain. So it's proven far beyond a reasonable doubt, and there's no way they could justify that. And they've reoccurringly violated 18 USC SS 1513, the retaliation against a victim, witness, and or informant statute, and they've reoccurringly violated SS 766.110, the healthcare facility liability statute. And they've reoccurringly violated both of those statutes together several times for several years. Well, the only thing I could think of more to do is to, sincerely ask you to please document what I've complained to you about today. And if you could write on the top of the complaint that it's urgent, so your supervisor or your superior could acknowledge that and help me as soon as possible.
I wish you and your family a better day. So you said your mom was kind of suffering because of it. So I hope that gets better for all of you.
Thank you for your concern. Is there anything I could do for you?
No, sir, that's very kind of you to ask. That's just
All right. You have a great day, ma'am. And please, once again, document the complaint. I'm literally begging you from the bottom of my heart. Please document the complaint and put urgent on it so they can help me. Thank you. Assalamu alaikum wa rahmatullahi wa barakatuh. The time now is 4:41 p.m. Today is Friday, March 21st, 2025. The duration of this audio transcript is 3 hours, 42 minutes, and 53 seconds. Assalamu alaikum wa rahmatullahi wa barakatuh.